So let's see what we got going on today. We know we're working on her 6th cervical right there. Okay, so since I saw you a few days back, you've been able to get back into the workouts?
I worked out yesterday. I felt actually better after I worked out.
Right there.
Mm-hmm.
It's a small one hiding from us. You're going to be doing bar. You did bar, so tell me what happened.
No, I did Pilates.
Okay, so all week was Pilates?
No, I only did it yesterday.
Okay. Here's what's interesting. We're back down at 5 now. Remember, so what happened was we've been working a lot on her L5. She's been doing really well with that. And she had a little episode about a week and a half ago, right? A week and a half, 2 weeks ago. And what was interesting is she came in limping. It was coming from her 3rd lumbar. We set 3rd lumbar 2-3 times. That's clear now. But it seems to be going back to this 5th lumbar. So we're going to set her 5th lumbar. We're going to set 1, 2, 3, 4, T5. And we're going to set C6 as well. Okay, so let's do this one first, and then we'll do these two.
Are you going to put me on that torture machine?
I'm going to put you on whatever's going to make you more comfortable. Were you okay on the side that we did the other day?
Yeah. It just, I don't know.
You smacked me on camera, right?
I did?
You know you smacked
No,
me.
I didn't realize it was just a reflex.
It was a reflex. So you had asked me last visit why on your heels. This in the cervical chair adjustment, it just seems to, when you're out on your heels, palms are up. That seems to be the most relaxing on the spine. There we go. She's a little tight today, just a little bit.
I had a really bad headache yesterday.
So I'm going to set this as a PRS pull.
Whatever that means.
I'm going to set it now straight PRS. Look up. There you go.
That's fine. Didn't hurt.
I had to go quick. That's okay. You are walking a whole lot better, lady.
I was in bad shape.
It was pretty. You came in like this. You were like this.
Yeah, I was in bed for 3 or 4 days before I came. Icing.
It's back to L5, so there must have been something that tweaked it out.
Well, a few weeks before it really went out, I'd be standing and my lower back would be starting to hurt. And I think, oh, what's going on here?
T5. There you go. Hands down to the floor, please. Let's get a little more double thumb. Palms up. There you go. There. Gotcha. I'm going to prep the low back here, okay?
Mm-hmm.
If we feel it, we'll do it. If we don't, we won't. Let's just see how we feel.
Don't be careful. I'm so nervous.
Yeah. No, I'm not going to thrust, I promise, okay? I'm just applying pressure. Deep breath in, blow it out. Deep breath in, blow it out. We're just prepping. Blow it out. Remember, if the patient is not relaxed, we're not going to go through that. I'm just prepping, okay, Victoria?
Yeah.
I'm not thrusting. Go ahead. Okay, let's go on the other table now and get it. I wouldn't, if the patient says that, you
I don't know why I've become such a chicken about it.
You're a little apprehensive today.
I know.
What happened?
Because you murdered me last week.
Let's go to the other side. Well, I'm trying to avoid that table, but if push comes to shove and we don't get it here, that's
Didn't you get it on the other side?
I got just a piece. I didn't get what I wanted, though. Let's see if we can do it here. I'm not,
on this table.
otherwise I'm not doing
I'm
not doing my job. There we go. Nice and easy. Nice and easy. Gotcha.
That didn't even hurt. I was making such a big deal about it.
Uh-huh. That's clear. It was right there. I am going to check the ribs once I'm done here. I do take a little more time than the average Gonstead doctor. Like you saw, I adjusted her spine, it cleared. Then the rib is out. We're going to check the ribs. You know, we get into this habit and motion of scope, palpate, adjust. You get it in 2-3 tries. Great. If you don't, come back. Tell the patient to come back. I like to go for it, you know, and if they're coming with their time, their resources, all that. You feel that right there, Victoria?
It's out, isn't it?
Yeah. See the difference there?
Mm-hmm.
Right there.
How does a rib get out?
from a vertebrae being out. And it happens to be at the same level as the vertebrae that's out. 1, 2, 4. Now, typically I wouldn't do this, Victoria, okay? What I mean by that is the bone correction will correct most of the rib. Deep breath in, blow it out fast. There. You feel that last one? That was it.
Was that the bone or what was
That was the rib going back in place. So, and we're not taught to do that. So you don't want to adjust the bone and the rib at the same visit. Just like you don't want to adjust the low back and the pelvis on the same visit. I was trained by the doctors, they told me you don't let them leave. If you know there's a problem and you can help them, you fix it that day.
That's why I keep coming back again and again and again.
Stand up, let's check the hands. Squeeze. Squeeze.
Ooh,
There. That's the last one in the
that
elbow.
hurts. What is that? Why is that hurting?
So can you go on the floor and put your hand on the table, please? We're going to use the extremity board just to get faster and it won't hurt her as much. Come up so your forearm is parallel. There you go. And I'm doing the posterior distal radius first. Posterior lunate.
Ow!
It's all love. Posterior lateral scaphoid. There, that was it. And seed the joint. Okay, you're all clear now, my dear.
Okay, so do you want to see me next week?
End of the week now. Down. There you go.